Welcome back. Thanks for staying with us. The international NGO Sisters for Change spearheaded a two-day workshop to engage civil society on matters regarding legal advocacy relating to discrimination against women and girls and members of the LGBTQI community. The workshop was seen as an opportunity to address the problem of public positions pushing private agendas. The NGO looks to combat divisive laws and work towards a more reformed legal framework.
Civil society groups came out in full force to be a part of the Sisters for Change two-day workshop held on 21st and 22nd January. A room full of movers and shakers engaged in lively conversations centered around matters of parliament, legal framework, and consultation issues. Legal Director of Sisters for Change, Jane Gordon, says the workshop provided the opportunity for engagement of parliament and bringing across the importance of public consultation before decisive action is taken on significant matters.
More on two things. One, engaging Parliament and parliamentarians on why they should be thinking much more about public consultation and about integrating public consultation engagement within the legislative process so that the public can share their views, their experiences, their concerns around draft bills and hopefully strengthen and improve those bills for the needs of society. And on the other side, bringing civil society together with parliamentarians so that they can understand much more the actual process of legislative reform, but also how Parliament works, how they can get access to parliamentarians both in the Senate, in the House of Assembly, how they can get involved in actually talking about draft bills, and also so that they can understand the procedures. So there's been a lot of discussion this morning, for example, on the standing orders of the House of Assembly. Many civil society organisations are just not familiar with that. So some of this is about a knowledge exchange and some of it is coming together, recognising as we move forward the kind of principles of public participation, civic engagement in legal reform.
Concerned members of public in the past have argued that personal agendas are oftentimes pushed in Parliament. Gordon says this heated matter was also a high point of conversation at the Sisters for Change workshop.
The parliamentarians have been very honest, actually. A number yesterday acknowledged that we are in the context in St Lucia and we have speakers from the Bahamas and from Barbados, and we have other MPs sharing their experiences from Kenya and a senator from Antigua and Barbuda. And there's been frank comments that because of the small size of the Caribbean states, there is a danger of an incestuous relationship between Parliament and the executive, but also that sometimes there is that incestuous relationship between personal agendas and the public good. And I think one of the questions is how to make sure that there is more of a formal process around engaging civil society, engaging the public in the process, rather than just because you happen to know an MP or a member of Parliament or they're your brother or sister or wife or husband. So I think this is about formulating a more formal process to make sure that we have a wide range of views properly represented as reforms are made to laws or as new bills are introduced.
Sisters for Change desires to bring about transformation through legal advocacy, legal programs, and legal empowerment. The organization is also a member of the Equality and Justice Alliance that includes a consortium of 4 international NGOs working across the Commonwealth to combat laws that discriminate against women and girls and members of the LGBTQI community. Reporting for Hot 7 News, I am Solange Alfred.
It is said that a country's wealth is a country's health. And so the topic of the national healthcare insurance was addressed by the governor of the Eastern Caribbean Central Bank, Timothy Antoine, at a recent press conference. Antoine visited St. Lucia as part of the bank's outreach initiative. The governor provided some choice words of caution to the government before moving into establishing a national health insurance.
Quality health care at an affordable price was one of the focuses of Prime Minister Alan Chastanet during the 2019-2020 budget address. On the point of national health insurance, the Prime Minister noted the government's stance to provide coverage to the poor and most vulnerable of society. A National Health Insurance Committee has been set up to present the best model and financing options to the Cabinet of Ministers. Governor of the Eastern Caribbean Central Bank, ECCB, Timothy Antoine, offered sound advice to the government before embarking on any national insurance scheme.
We are supportive of government's efforts to bring on stream a national health insurance. However, we do have a word of caution. Healthcare is extremely expensive, and therefore the management of a healthcare system, including national health insurance, is going to be extremely important in terms of also managing the fiscal accounts. So we give the following advice. In terms of moving forward the national health insurance, it's very important to continue to promote very strongly primary health care, which is prevention, healthy and active lifestyles. Because what we've found, and you look around the region, you look at BVI, you look at Turks and Caicos, you look at Cayman and others that have national health insurance, the secondary health care and tertiary health care, that is where people are hospitalized or where people need advanced procedures, are extremely expensive and very difficult for the state to manage.
He cautions the government about the way forward to a national health insurance state.
But we also have a word of caution. Governments must work with citizens to ensure the promotion of primary health care. That will reduce the impact on the fiscal accounts. Secondly, we believe that it is very important to have a very lean administrative arrangement. That is to say, avoid building up a large bureaucracy to manage the national health insurance. That itself is a cost. Our recommendation has been to leverage the National Insurance Corporation or the National Insurance. Separate funds, because the national insurance deals with pensions and certain benefits. Health insurance is separate and has to be separately funded. But to leverage the administrative platform that already exists rather than create an additional bureaucracy.
Meanwhile, leader of the opposition, Philip J. Pierre, continues to call for transparency with any movements made to provide national health care insurance to St. Lucians.
There was a committee formed comprising of people from St. Lucia and the EU dealing with universal health care. We know it's not simple, we know it's not easy, but the work was in progress. We've not been told why that committee was dissolved. We've not been told why the hospital was not completed, because when we were in government, the process was in place. There was a process in place, you understand? So the whole idea of insurance, we know nothing about it. I would have thought that with such a serious issue like health insurance, there would have been some white paper or some paper that would have been distributed so we can discuss. We know nothing about it, so we can't speak to it. What we know is that it was in the public domain that when the Labour Party was dealing with universal health care, there were discussions in the public. Everybody knew what was happening. We know nothing about health insurance, so I can't comment on it.
The governor further recommended that standards be implemented for healthcare providers. Reporting for Hot 7 News, I am Solange Alfred.
Julia Evans, affectionately known as Ma Alexon, is the latest centenarian of Soufrière. Evans was honored with a hamper by the Soufrière Regional Development Foundation as she celebrated her 100th birthday today, Thursday, the 23rd of January.
Well, Miss Julia, it is actually an honor to be able to do this with you. Not many of us get to this point. And so I pray well then that your blessings is actually rubbed off on myself, apart from your children as well. That I get to see 100 as well. So we want to honor you on behalf of the SRDF. We would like to honor you, Miss Julia, for actually getting to that point. You are actually a centurion here in our town of Soufrière. So we want to honor you and thank you.
The 100-year-old says she is grateful to God for granting her the strength to reach this milestone.
Mais là, il vient pour manger, pour manger au kitchen corps, pour manger, what the qui advise you savon you like pour ça.
Recalling her childhood days, Evans reminisced on her active lifestyle and healthy diet. Her 100th birthday celebration began with a Thanksgiving Mass on Thursday, and it will continue with a grand celebration on Saturday. Minister for Education Dr. Gail Rigobert recently met with her education managers to chart the way forward for the sector for this academic term. District education officers, principals from primary and secondary schools from both the private and public sphere, the Chief Education Officer, the Deputy Chief Education Officer, and the Minister for Education came together for a meeting of the minds on the development of the education sector for this term. During the meeting, progress updates were given on a number of initiatives, including the Education Quality Improvement Project, EQUIP, and its significant focus on special education.
That it is a very significant endeavor on our part to ensure that those students who, for whatever reason, have not been able to perform as expected at that age, that we are taking a decisive step to invite them to benefit from the program at CARE so that we do not lose them in the system.
The minister noted that particular focus is also being given to technical vocational training through the TVET program. She pointed to the statistics in Latin America that show that TVET qualified individuals tend to earn 10 to 15% more than other workers.
I do not think, as good educators, we should subscribe to any notion or presumption of what traditionally referred to as academic and non-academic subjects. And it's something I have charged the TVET Council with, I have charged the TVET unit with. There is so much more work we have to do to erase the stigma attached to TVET. Again, ensuring that our children who are differently abled, who have learning challenges or difficulties, that they are catered for, that they are facilitated. And I want to embrace the notion that that should not be a culmination point, but the ambition should always be that at some point some of them can be reintegrated into mainstream education.
The minister says the particular challenges of advancing St. Lucia's education sector to ensure that no child is left behind requires a combined effort from stakeholders, and forums such as the term meeting gives everyone a voice to influence how the sector moves forward. This is the Hot 7 TV Nightly News. Sports and weather are coming up after the break.